So let's look at what a personality is, just some basic background. So a personality is a set of characteristics or traits that make up our patterns of thinking, feeling, and behaving. So you can kind of think of it like a psychological toolkit, right? These are the tools that we have for living. The tools are called traits. And I'm going to use that word over and over again today. And I want you to kind of keep it in the back of your head because it's going to help us describe sort of what is going on with individuals with personality disorders. And this trait or set of traits is a cohesive set of thoughts, feelings, and behaviors. Okay. And generally speaking, we'll use those to make decisions about things going on in our life, or what we're going to eat today, or what time you have to go someplace in order to be on time for the webinar, or whatever it is. But it's overall, our personality is this combination of all these thoughts, feelings, and behaviors. But let's talk a little bit about what we know about personality disorders. So first off, they're a unique mental health condition. So when I mentioned before, they don't present in the same way that someone who comes in and has depression or has anxiety or some other mental health issue. Not that clients who are personality disordered come in and say, hey, my name is Ellen and I think I have a personality disorder. Very rarely does that happen. Generally, they will come in with particular complaints of one thing or another, but they tend to be somewhat vague. They require distinct intervention methods that are different from traditional symptom-oriented mental health interventions. So when you think about working with personality disordered individuals, I want you to think about the fact that the way that we're going to deal with them, talk to them, interact with them is going to be different than if you're working with other mental health issues, okay? We're going to have dialogue, conversation, communication, and collaboration differently with people that are personality disordered than we will with another mental health issue. These disorders are generally frequently mistaken for other mental health problems. Some of those might include dissociative identity disorder, bipolar disorder, dysthymia, what is now referred to as persistent depressive disorder, PTSD, ADHD, conduct disorder, lots of things. Generally, I have had people that have come in that end up presenting with what is actually a personality disorder who have had some other diagnosis along these lines or other things. They're not generally coming in and saying, hey, somebody diagnosed me with a personality disorder. They're actually more prevalent than we originally thought. In the clinical population, they can be anywhere from 39 to 100%. In general population, about 15 to 19%. And they're frequently underdiagnosed. And as I mentioned a minute ago, that's usually because they present with vague or sort of indistinct complaints, like, I just can't do what I need to do in life, or people don't understand me, or I don't know why I don't follow what the doctor is asking me to do. They tell me to do things and I just can't do it, and I can't figure out why I can't do it. But it's not specific things that they're dealing with. Whereas if someone comes in and they report that they have feelings of depression or they're depressed, they'll specifically say, I can't get out of bed, I haven't gone to work for a week, I'm losing weight, I'm having negative thoughts all the time. You know, that's not generally what you're going to hear from someone with a personality disorder. And it's mainly because they don't have the insight for that, which we'll talk about in a minute. They are often associated with substantial trouble, both clinically and culturally. So personality disordered individuals have elevated homicide and suicide rates. A lot of times there's recurrent spousal abuse or failure to leave their abuser. They have experienced child abuse themselves, or they are child abusers. High risk health behaviors, illnesses and medical problems in relationships and within their family system, family of origin. They might be treatment non-compliant, and many times have addiction issues. And they're not necessarily only substance abuse. They can also be process addictions or behavioral addictions. And the treatment non-compliance is actually pretty consistent. So if I'm working with an individual who has an addiction issue, and of course I'm treating that first before I would treat anything with personality disorder, I'm going to want to know past, treatment. Have you been in rehab? Did you go to detox, et cetera? And if I see a history of treatment non-compliance, meaning there's been, 10 visits to rehab, none of them have been finished, they've dropped out, they can't seem to get sober over a long period of time, then I'm actually going to be thinking about, okay, maybe there's some personality issues going on. So that's something to pay attention to, because generally when people don't have a personality disorder, if they decide they're going to work on recovery, they're fairly successful. That doesn't mean that they're going to not relapse occasionally, but they're going to be able to follow along with the guidelines of whatever their recovery program is suggesting and work towards that end. But with individuals that have particularly cluster B, we're going to see a lot of non-compliance with regard to that. They're seen in all stages of life, including childhood. So my experience has been that individuals with personality disorders have always shown some signs of the personality disorder, whatever it might have been, from very early on, even birth occasionally. These are not, in my experience, situations in which someone has gone along in their life, everything has been wonderful and fabulous, and then boom, they hit age 26 and suddenly they're in full-blown personality disorder mode. That typically is not, you're not going to see that, okay? Now, can the behaviors get worse over time? Absolutely, particularly if there is an issue with, just lost my train of thought. If there's an issue with positive or negative factors in their life. So for example, if something traumatic happens or they experience an obstacle in their life, then that might exacerbate some of the characteristics and the behaviors that you would see in the personality disorder. And they frequently fail to comply with treatment regimens, which I mentioned previously. They frequently have a difficult time forming collaborative relationships and therapeutic alliances. And are often unaffected by traditional psychotherapy approaches. So if you've worked with individuals that are not, all of the things, all your tools that you usually use as a therapist are not working with this individual, it is probably because there's some sort of personality issue going on. And of course, we know that the most important thing when you're working with clients is the relationship you form with the client, the therapeutic alliance. And since individuals, particularly with cluster B, have a difficult time with that, the things that you're using, the tools that you're using in your approach probably aren't going to work as well with regard to this particular personality that you're working with. They may exhibit unreasonable, demanding, resistant, and avoidant behaviors. They create drama and distress in the people around them. And so there's another word that I want you to put a pin in. Drama is something that happens with all personality disorders, particularly with cluster B, okay? The opposite of drama is problem solving. So we're not seeing a whole lot of problem solving when you're talking about clients with personality disorders. We're going to be teaching them that, of course. And then their presentation is seen as difficult or bad rather than sick. So, when someone comes in and they're struggling with anxiety disorder, they've had panic and they're having a hard time sleeping, things like that. They're in a great deal of distress and they present as, this is terrible in my life and I really need to find out how I can change this and get better and all that. That is not going to be how a personality disorder individual presents. Okay, they're not presenting as I'm feeling terrible and I just can't get motivated and all that, they're going to present as difficult or bad. And a lot of times they're not sure why they're even in your office. Okay. Because as we will discuss, there's very little insight into what is going on with them. Yes, Michelle said, I've found that they present as very seasoned with the therapy process. Absolutely, because they've most likely been to multiple therapists, all of which have been horrible, even though they probably weren't. So a personality disorder is a characteristic condition, not a symptomatic condition. So we're not treating symptoms of this disorder. We're treating the character of the disorder. So the way you might think of it is we are performing surgery and we're not taking anything out. We're going to put things in when we're working with them. Okay. Because they're, as you can see, you will see in a second, they're deficient in many things.